Ryan Reynolds here for, I guess, my 100th Mint commercial. No, don't. No. I mean, honestly, when I started this, I thought I only have to do like 4 of these. I mean, it's unlimited premium wireless for $15 a month. How are there still people paying 2 or 3 times that much? I'm sorry, I shouldn't be victim blaming here. Give it a try at mintmobile.com/save. Whenever you're ready.
$45 upfront payment equivalent to $15 per month. New customers on first 3-month plan only. Taxes and fees extra. Speed slower above 40 gigabytes. See details.
I'm sure I don't need to explain sexually transmitted diseases and how they happen. I assume you learned this either from health class or your friends. But something is happening that has health department officials worried. They are seeing cases of congenital syphilis. That's when a baby contracts syphilis from their mom during pregnancy, and it can cause horrible effects on the baby. So it's time for all of us to have an update on STDs, because nobody in this country should have syphilis, and certainly none of our babies should be affected. So this is your graduate level health class. What has happened in the world since you last studied this stuff, and what exactly do you need to know? First, a lot of these infections don't cause any symptoms, so you may not know you are carrying the disease. And a rising number of pregnant women are saying no to being tested for these diseases, so doctors are seeing cases pop up. Besides not testing, another thing that has me nervous is I've had parents not want to tell their doctor that they have had, say, herpes before, which can totally affect the baby and is easily treated if we know about it during pregnancy. Unfortunately, stigma prevents some people from talking about these things, so I'm talking about this today. I'm Dr. Wendy Hunter, and I'm the pediatrician next door. I'm that doctor friend you call for practical advice about your kid's health. I mix the science of medicine with the reality of parenting. When a pregnant woman goes for prenatal care, she is tested for hepatitis B, Hep C, chlamydia, and a bunch of other microorganisms. Which ones we test for partly depends on their age. And she'll be recommended vaccines. I know a lot of parents question why these tests and immunizations are routine. They are to prevent, as best as we can, babies from being born prematurely or with low birth weight, birth defects, or even miscarriage and stillbirth. Sadly, these things do still happen. Health officials monitor closely and make new recommendations to protect newborns from all kinds of different diseases, and strangely enough, one of the biggest threats to infants are actually sexually transmitted infections.
I'm Winston Tilghman. I'm the medical director of the HIV, STD, and hepatitis branch of Public Health Services at the County of San Diego Health and Human Services Agency.
Doctors like Winston Tilghman keep us updated on diseases that we need to be aware of. I thought that as a pediatrician, I would not have to keep up with the new information about sexually transmitted infections, or STIs, as we have taken to calling them, but I do. And one of the ways that we keep up is by getting updates from the health department. Recently, Dr. Tilghman's group updated us about the concerning rise in syphilis-associated stillbirths. We call these sentinel events. They may not be common, but they signify that there has been a change in people's behavior, and we need to react before the problem becomes more common. Here, Dr. Tilghman updates us on this somewhat sensitive subject.
There are several STDs that can actually be quite catastrophic to babies. The primary one that I want to start with is syphilis, and I'm starting with that for 2 reasons. The first is that it can cause multiple problems, including visual loss, hearing loss, multiple complications during pregnancy, stillbirth or birth of a dead baby, and problems into young adulthood and adolescence if it's not identified and treated promptly. And the second reason is that we actually have been seeing increases in congenital syphilis in San Diego County, in California, and in the U.S. as a whole, starting since around 2013. Congenital syphilis is considered one of those never events or a sentinel event that indicates that our safety net system is not effectively serving everyone that it should be. So one case of congenital syphilis is considered too many, and we've seen much more than that in recent years. One case is one too many for us. And the reason why congenital syphilis is considered a sentinel event is that it is preventable through testing during pregnancy. And if someone has syphilis during pregnancy, prompt treatment during pregnancy. That's highly effective for preventing congenital syphilis. So there's no reason why we should be seeing any cases. Even if people don't know about congenital syphilis, if they're going in for prenatal care, as soon as they find out that they're pregnant, they're going to get tested for syphilis. It's mandated by law in most states, including California. And due to the rises in congenital syphilis, additional screening is being recommended during the third trimester and again at delivery in many cases. So people may be getting screened for it and not knowing about it. But as long as people are accessing prenatal care, that screening will happen. Just about every year between 2013 and 2022, we have seen at least one stillbirth, and the stories are always very sad, especially when there were maybe times where someone could have gotten a test and just didn't because it wasn't available, or they come to deliver at a hospital without having received any care, and then it's too late to do anything. And those are really the tragic cases that keep me up at night, and that I really am hoping we can continue to prevent or eliminate again. There's no reason why we should be seeing these cases. In terms of other diseases that can be threats to babies, herpes simplex virus is one of those. That's the cause of genital herpes as well as orolabial herpes. People can have successful pregnancies while living with herpes. However, certain precautions should be taken either to prevent having herpes or getting herpes during pregnancy, which can be a dangerous situation, or if someone has herpes already, avoiding any symptoms during pregnancy that could present a risk to a baby during delivery.
It's interesting because I find that a lot of parents are shy and they don't want to admit that they have an infection. And these are not uncommon infections to have. But what role does that play in babies being born without having been protected from their mom's infection?
Yeah, that's a great question. Unlike syphilis, for which we have screening tests available that are mandated, like I said, by state law and really an integral part of prenatal care. Yeah, herpes does require some communication between patients and providers. And as you mentioned, stigma is a major issue with respect to all of the STDs, and I think sexual health in general. Hopefully, prenatal care providers and primary care providers are asking about sexual health, since it is an important component of overall health and well-being. However, I do encourage people who have genital herpes or orolabial herpes and are becoming pregnant or considering becoming pregnant to discuss it with their provider. It may be uncomfortable, but it can really be life-saving.
Not only do some STIs hide and cause health problems in pregnancy and in newborn babies because their moms may not show symptoms, some of these infections people just don't talk about and people don't always tell their doctor. So they can pop up for that reason too. Pregnant women are tested for many of these diseases, but not all of them. What other diseases do we need to worry about?
So other diseases that can affect babies' health include gonorrhea and chlamydia. Screening for these infections it's also very common during pregnancy. It's a little more risk-based, so providers may ask questions that you may not be used to hearing if you're pregnant and you're going in for a prenatal care visit. But they're really trying to determine if you would benefit from testing for gonorrhea or chlamydia. In general, testing is recommended during pregnancy for anyone aged 24 years and younger. And then for people aged 25 and older, it's based on risk. So if they have a new sexual partner, multiple sexual partners, or other risk factors, then screening would be done at least once during pregnancy. And we have very effective antibiotics to treat both gonorrhea and chlamydia. And to prevent eye disease from gonorrhea specifically, it's pretty much standard practice to provide antibiotic prophylaxis to neonates. It's an antibiotic called erythromycin, so we very rarely see neonatal gonorrhea, or a condition that is called ophthalmia neonatorum. It's not as effective at preventing eye disease due to chlamydia, but neonatal chlamydia is largely prevented effectively through screening during pregnancy and treatment of those who are positive.
What's the current state of affairs with HIV?
Right. Well, we've made significant strides in terms of both managing HIV and preventing HIV. In terms of HIV management, we have multiple classes of what we call antiretroviral medications, which specifically target HIV and maybe some related viruses. Treatment has evolved significantly since the beginning of the epidemic in the 1980s. They're safe, they're very, very tolerable, they have much less side effects than medications that we were using kind of in the early days. People can live long, healthy lives with HIV thanks to these medications. The medications basically suppress the virus so that the tests that we use to detect HIV in the blood are not able to detect HIV in the blood, and that's called an undetectable viral load, or someone being undetectable. Another thing that we know about antiretroviral medications and achieving an undetectable viral load is that people who have undetectable viral loads for at least 6 months or long-term viral suppression don't transmit HIV to sexual partners. And so this is, really just amazing in terms of how far we've come. There are medications similar to the ones we use to treat HIV that can be used on a regular basis to prevent infection. They're highly effective. There are 2 oral medications and 1 injectable medication, right, that are currently approved for what we call pre-exposure prophylaxis, or PrEP. We have seen in recent years a decline in cases, but we are still seeing a few hundred cases per year, because despite these advances and all of these tools that we have to both prevent and treat HIV, they're not all reaching the people who need them.
So if you're someone who's at risk for contracting HIV, there are medications you can take to prevent getting infected, and you would ask for PrEP. That's what you would look for if you were calling your doctor?
That's correct.
That's the perfect segue to talking about updates in STDs since you were last in health class. You never know when you might need to know some of this stuff, and it's not really covered in the news or on Instagram. We get into the nitty-gritty about STIs in adults and your adult children next.
Ryan Reynolds here for, I guess, my 100th Mint commercial. No, don't. I mean, honestly, when I started this, I thought I only have to do like 4 of these. I mean, it's unlimited premium wireless for $15 a month. How are there still people paying 2 or 3 times that much? I'm sorry, I shouldn't be victim blaming here. Give it a try at mintmobile.com/save. Whenever you're ready.
$45 upfront payment equivalent to $15 per month. New customers on first 3-month plan only. Taxes and fees extra. Speed slower above 40 gigabytes. See details.
Before the break, we talked about the effects of infections on babies, but the consequences can be far more reaching in terms of affecting fertility as well. Here's more of our conversation.
The consequences of an untreated STI can actually be quite significant, particularly chlamydia and gonorrhea. Without prompt treatment, they can lead to what's called pelvic inflammatory disease, which is infection of the uterus, the fallopian tubes, and sometimes infection of the ovaries. And that can lead to infertility and chronic pain. It also increases the risk of a condition called ectopic pregnancy, which is when an embryo implants in the wrong place, and that can be a surgical and life-threatening emergency. For that reason, there is a recommendation for all young women age 24 and younger who are sexually active to get screened for gonorrhea and chlamydia regularly.
Are they always symptomatic? If you have gonorrhea or chlamydia, will you know you have it?
Great question. Actually, many STDs are asymptomatic, or people who have them don't know it. So that's why screening and getting tested, even if you're not feeling badly or having symptoms, is important. Because even asymptomatic infections can lead to complications and can be transmitted to partners. But yes, condom use is not always 100%. And, condoms not only need to be used consistently, but they also need to be used correctly to effectively prevent STDs and HIV. And then there are some STDs, for example, human papillomavirus, where there could be bumps or lesions in areas that aren't covered by condoms. And so condoms are important, but some of these other prevention methods that I've mentioned, in addition to vaccination for HPV or human papillomavirus, are important. So it's important for our youth, to really know what they need to be on the lookout for, what options are available to them to protect themselves and stay healthy.
I'm really glad you brought up HPV because this can be a really contentious topic, especially in my clinic where a lot of parents don't want to vaccinate their kids. And my take is that the vaccines are extraordinarily effective and they're very effective the younger you give them. And the fear that I have that I don't think parents realize is that I have a number of adult people I've heard of in their 40s even who are getting throat cancer from HPV. And that is a sexually transmitted infection that ruins your life and was totally preventable. So I was wondering if you could speak to that at all.
Yeah, absolutely. Yeah, I definitely understand that people may have concerns about vaccinating their children or even becoming vaccinated themselves for an infection that is primarily transmitted through sex. The vaccine is safe. We have a lot of data on the vaccine, and it's a very safe vaccine. So the way I try to sort of frame it to people is that we have very few vaccines that prevent cancer. And so, no matter how HPV is transmitted, at some point, just about everyone's going to come into contact with it. Just because HPV is so common, most people who have it don't know they have it. And so the risk for exposure goes up exponentially once someone becomes sexually active, even if they only have one or two partners their whole lives. It's that common.
This is difficult stuff to think about and talk about with our kids. And the best way to think about all of these issues, including vaccinating for HPV, is to understand what diseases are out there, how they can affect health, and how dangerous they are. There are some infections that are not as dangerous, but are still good to know about. Here's another one we talked about.
I think it's also good for teenagers to be aware of trichomonas, which mainly causes vaginal infection or vaginitis. It can cause complications during pregnancy. It can increase the risk of HIV acquisition or getting HIV. And most of the time, it's women who are symptomatic. Men can get it, but it doesn't typically cause symptoms in most cases for men. So it's a parasitic infection. It's easily treatable as well. And it usually causes vaginal discomfort and discharge. It doesn't cause as many serious complications as some of the other STDs that I've discussed, but it is very common and it's something else just to be aware of.
Dr. Tilghman covers a range of cases, and when a new concern arose recently, it was added on to his responsibilities. His new case is monkeypox. Actually, it's Mpox. The World Health Organization recommended the name change back in November of 2022 to reduce stigma and discrimination associated with that original name. I don't want to go off on too much of a tangent here, but I can't help myself. Everyone keeps saying the name was changed to reduce stigma. And I was like, what, are we offending monkeys? Okay, here's the real answer. The discrimination associated with the term monkeypox primarily involves human social issues rather than offending monkeys. First, apparently the name monkeypox can contribute to discrimination against certain groups of people. This can include like racial or ethnic communities if the disease name becomes associated with that group, leading to social stigma. Secondly, the term monkeypox might incorrectly suggest that monkeys are the primary source of the virus, leading to confusion about how you can get the disease, as well as blame and potential harm to monkeys. While the virus was first identified in monkeys, it's primarily spread by rodents and other small mammals. And lastly, experts say that simplifying the name to Mpox helps create a neutral and less alarming term. Although I kind of find it challenging. future generations are going to be confused about how to pronounce it. It's the only word in English that I am aware of that starts with MP, although Scrabble players everywhere are going to be thrilled with this new name. Aside from the very entertaining history of the name, do we need to care about Mpox? What does it do, and who's at risk?
What Mpox does is it can cause a rash. It can be widespread. It can be very painful. And some people can get what we call prodromal symptoms like fevers and chills and just fatigue prior to developing the rash. There are some complications that can occur, especially in people who have suppressed immune systems and pregnant people, also children who get Mpox. And so we started to see cases of Mpox in countries where we don't normally see Mpox, sort of spring of 2022. And now, over 100 countries or much more have reported cases. So it has spread beyond Central and West Africa, where it's mostly been confined. In 2022, the outbreak primarily affected the LGBTQ plus community. So it was first kind of identified in European countries, and then we later identified cases in the United States, and we're still seeing cases that are most likely being transmitted through close contact, including sexual contact. There is a vaccine that can prevent Mpox. It was actually developed for smallpox, which is a related virus to the Mpox virus, but it's not the exact same virus. It's a 2-dose series, and it's highly effective at preventing Mpox. We do see some Mpox cases among people who are fully vaccinated, but when it comes to serious disease, hospitalization, and death, the vaccine is highly protective.
Here's what's really interesting about STDs. This is why we need to care and why Dr. Tilghman is responsible for this particular group of infections. This group of microorganisms have unique mechanisms that help them survive and spread through a population of people. These are insidious diseases, and while we largely keep them under control through routine testing and providing treatment, anyone who witnessed the early days of AIDS and HIV, they know we have to be vigilant because in a tightly connected, complex human social network, new infections can spread really rapidly. Since STIs are primarily transmitted through direct contact between mucous membranes, those are the moist surfaces of your body, these pathogens are delivered directly to the most suitable environment to set up an infection. STIs have evolved to thrive in the warm, moist environments of mucous membranes. And some of these diseases like HIV and herpes, they can evade our immune system so they can grow for a long period of time undetected. Some STIs can enter a dormant phase and reactivate later. For example, herpes simplex virus can remain inactive in nerve cells and reactivate, causing recurrent outbreaks. And as you've learned, many of these diseases are asymptomatic, which lets it infect a population without being noticed. And some of these diseases, like HIV, have a really high mutation rate, so they adapt to our immune system and to our treatments. This is how they survive and spread despite our efforts to control them. Understanding these mechanisms helps public health officials to develop strategies to prevent and control their spread and to prevent complications. Thank you to Dr. Winston Tilghman for staying vigilant. I know this can be a difficult topic to talk about with kids, so instead, listen to this episode with them or share it with others. You don't know who you're going to help by talking about this. If there's a sensitive health topic that you want to know more about, but you're not sure who to ask me. For more from the Pediatrician Next Door, find me on the web at pediatriciannextdoorpodcast.com. If you've got a question about the weird things kids do, send an email to hello@pediatriciannextdoorpodcast.com for a chance to hear your voice on the show. I'm Dr. Wendy Hunter, and I'm the Pediatrician Next Door. This show is produced by Red Rock Music. Make sure to subscribe and leave a review wherever it is you're listening. I'll be back next time with more.